Good afternoon. Thank you all for being here today on Friday, July 24th. We are still in the middle of our most painful period of COVID-19 spread during 2020 and during this pandemic. We have talked about this for weeks now. We want to continue to remind you that we must continue to work together to slow the spread of this virus, to prevent our healthcare system from becoming overwhelmed. And while we've tried to explain exactly what that means, I want to try to do it again today. I want to be clear about what an overwhelmed system looks like. It's not like on or off switch, right? It's not like turning on a light and turning it off. There are degrees to which quality of care can be delivered. For instance, whether you have COVID-19 or you're in an automobile accident or if you have a heart attack, the difference between going to an emergency room and being treated within the first 20 minutes or getting in an ambulance and driving for 2 hours to the first available bed is a very different outcome long term. The difference between having doctors and nurses that are working on you that are well rested, that have not been overwhelmed, that have not been working 22 hours a day, 7 days a week, versus those who have, is just a different level of quality of care. We're all humans. And so when we look at and talk about our hospital system, it's not as if one day we're going to tell you, hey, we are getting close to an overwhelmed system, and the next day we're going to come in and say, boom, it's done, we're overwhelmed, nobody can go to the hospital. It's degrees, it's levels, it's Dr. Dobbs and I and his team and our team looking a week out and 2 weeks out and making projections and predictions on where hospitalizations are going and what does that mean to the overall quality of care for Mississippians. And so that's what we're talking about when we talk about an overwhelmed system. If you go to an emergency room in the state of Mississippi today, you're going to get treated. But the question becomes, how long in the future is that a guarantee? And at what point is the quality of that care compromised, not because of the quality of the person necessarily that is treating you is not high quality, it's just eventually there's only so much that one can do. And so we know for a fact that we are stressing the system. We know for a fact that Dr. Dobbs and I are working very hard to lean on our hospital and healthcare administrators to surge capacity. We know for a fact that some of them are doing that, and we appreciate their efforts. And we know for a fact that I, at least, am going to continue to push for even more surge capacity within our healthcare system and within our hospitals. But we also know for a fact that that alone is not going to solve the challenges that we face. There's going to have to be additional sacrifices made by the people of Mississippi. None of those sacrifices are fun. I don't like it. You don't like it. We don't like it. But we are where we are. It is 2020. And in 2020, things aren't like they were in 2019. 2019, I was running a political campaign, working 20 hours a day, 7 days a week, and I never thought I would long for those days, but I can assure you that I long for those days rather than dealing with this virus. But the reality is, it is before us. It is our responsibility as leaders to step up. It is our responsibility as citizens of Mississippi to step up, to help our friends and to help our neighbors. And therefore, what I want you to know today is we're going to make numerous announcements today. We are actually going to make news in doing a few things that we've been talking about for several days now, wherein I am going to either have or will sign executive orders before the end of the day that will go into effect immediately to do the following things. Number one, 6 more counties have made the qualifications for our more strict measures. As you will recall, we initially, almost 2 weeks ago, added 13, or initially added 13 counties. We then added 10 more. Today we are adding 6 more counties to the list that requires, among other things, mask mandates. Those 6 counties are Calhoun County, Holmes County, Lamar County, Montgomery County, Winston County, and Yalobusha County. The largest of those 6, obviously, is Lamar County. In Lamar County, we've had 254 cases over the last 14 days. That exceeds our very objective criteria of 200 cases over a 14-day period, and therefore we have added Lamar County. The other 5 counties are smaller, of course, than is Lamar and some of the other counties that we have added, but every single one of those 5, when you look at their 14-day counts, exceeds 500 cases per 100,000 residents. So we have added those 6 counties, Calhoun, Holmes, Lamar, Montgomery, Winston, and Yalobusha. We now have a total of 29 counties that have additional measures in place. In addition to adding those 6 counties, we are also going to add restrictions for the entire state, which include lowering our crowd limits for social gatherings statewide to a limit of 10 people indoors and 20 people outdoors. We know that it is no safer to throw a party in a parking lot than it is to go to a bar. We just can't be allowing that to happen right now because it is a death sentence for many who come in contact with those who are partying. It may not be a death sentence for those who come in immediate contact with them, but when they go back out into society, when they go back into their homes and they take it to their moms or their dads or their grandmoms or their granddads, it can be a death sentence, either for their moms or grandmoms, or if their moms and grandmoms or granddads work in our long-term care facilities, it can be a death sentence for the ones that they spread it to. So statewide, for those venues that do not otherwise have limitations, and so these are for social gatherings, mainly parties thrown at your house or other places, is now limited to 10 indoors and 20 outdoors statewide. In addition to that, we know that we've seen a tremendous amount of spread in our young people. By far, the group driving these higher numbers, we know, is people in their 20s. I've been talking for at least a week about wanting to do something to curb the spread amongst young folks that are going to bars and making careless decisions. I take no great pleasure in announcing this, but I think it's critically important. And in talking to Dr. Burks and her team on the White House Coronavirus Task Force and looking at states like Texas and Florida where they have completely shut down bars, I've made the decision to sign an executive order that in Mississippi, our bars must look more like restaurants and less like mobs of COVID-19 spread. Under this executive order, bars in Mississippi, both freestanding bars and those attached to restaurants, will still be governed by the 50% capacity restriction, but will now be required to have people be seated to sell alcohol. You can safely sit with a few close friends at a table, as long as that table is socially distanced and you're not in a group of more than 10. You cannot safely crowd up by the bar and mix with lots and lots and lots of people. In addition to that, we will also ensure that there will be a cutoff for alcohol sales at 11 p.m. because we know that that's when these crowds, primarily of young people, throw social distancing out the window. We will not allow sales of alcohol in bars around Mississippi between the hours of 11 p.m. and 7 a.m. We believe that these measures will allow for small businesses to remain open, hopefully to do so in a way in which they can continue to operate, continue to pay the bills, but also while limiting the spread of this virus. We had over 1,600 new cases today, and that is a number, as we've talked about, that is simply not sustainable. It pushes us towards almost 6,000 new cases, just shy of 6,000 new cases in the last 4 days alone. We have to do things a little bit differently. We have to be willing to make sacrifices as a state and as a people. We have to be willing to wear a mask in public. We have to be willing to change the way in which we do things. We can't go back to life as normal a year ago. And while I have no reason to be happy at all about any of this, I do believe that if we will now take the stricter measures that are in place and adhere to them, we will make a difference. At this time, I'm going to ask Dr. Dobbs to please give us an update on our numbers.
Thank you, Governor. Today we're reporting 1,610 new coronavirus cases, and sadly 28 additional deaths will be added to the death toll. If we look at how Mississippi stands in the nation, among U.S. states, we're number 9 in per capita cases in the last 7 days. So Mississippi is one of the leading states in the country as far as coronavirus goes. And in the southeast, we're led only by Louisiana and Florida. If we look at our hospital utilization, we continue to have issues with bed availability. We continue to see increasing numbers of coronavirus cases. If we look at the number of patients hospitalized with coronavirus, we have 975 as of yesterday, which is about 100 more than it was a week ago. We have 279 patients in ICU, and then, as I mentioned as an update, 163 on ventilator. 39% of all patients in intensive care are coronavirus patients, and 36% of all patients on mechanical ventilation are coronavirus cases. We today have 9 hospitals, major medical centers in Mississippi that have 0 ICU beds available. For testing, I would like to make sure that people know that testing will be available tomorrow and also Monday. Of course, we have our daily testing available at the Old Farmers Market on West Street in Jackson. South Haven and Pontotoc, there'll be testing locations tomorrow. So if you have any symptoms of coronavirus or think that you might have been exposed, we encourage you to get tested either through your regular clinic physician, or please use one of these no-cost clinics that are sponsored by the Department of Health, MEMA, and the National Guard. And on Monday, we have testing clinics again in Jackson as normal, and then New Holka and Clarksdale. The only thing that I would like to mention is that we do have provisions available for nursing homes to allow outdoor visitation if there are certain parameters met, such as no ongoing outbreaks or cases at the facility. So if you've been wanting to see your loved one, please contact the home and let them and see if they are eligible for outdoor visitation. We know that a lot of people are wanting to see their loved ones, and we have some guidelines that hopefully will make that as safe as possible. Thank you, Governor. That's all I have.
Thank you, Dr. Dobbs. This time I'll turn it over to Director Michelle.
Thank you, Governor. Just a couple quick things. Number one, just a reminder to everyone that as we rapidly approach the beginning of applications being open for our county and municipality CARES Act reimbursement, FEMA will be offering webinars next week to help assist counties and municipalities with better understanding the public assistance portal available at FEMA. That will kick off on Monday, and there will be a class each day up until Friday. Those links for those Zoom webinars will be available at my website at msema.org. And as well, if you cannot make the timed, scheduled Zoom meetings, there are YouTube videos available for you to use and view at your leisure. And then finally, just a tropical update, 4 systems out there. One off in the Pacific that obviously will not affect us. It's threatening the Hawaiian Islands. You do have Hannah that is rapidly approaching just off the coast of Texas that will be dumping a lot of rain this weekend down on the lower southern portions of the state. Tropical Storm Gonzalo is the one that we're watching intently to see what it's going to do over the course of the next few days as it enters the Caribbean basin early next week. And then there is a fourth system that we're watching just off the coast of Africa. Right now it's a tropical wave, anybody's guess. But just a reminder, we are in hurricane season. Pay attention and remember what we've told you about talking points in the shelters. Governor, that's all I have today, sir.
Thank you, Director Michelle. At this time, I'll open the floor to questions. Courtney Ann.
Governor, can you walk us through the decision-making as people are looking particularly at the bar restrictions? I know, like you said, you've been talking about it for a while now, and there were different variations that we've seen in other states. Can you talk about the decision-making, about the seated part, and, you know, is that coming from talks with folks in the industry, health experts? What was the decision-making process like?
Well, I think it's fair to say that we have certainly had many conversations with folks in the industry. We had many conversations with folks in the industry when bars were shut down back in I believe, April and early May. Many conversations regarding them. I have a very strong philosophical tilt against shutting down private businesses. It pained me to do so in April and May. Because I know that every single business is essential to those people who own it, as well as to those individuals who depend upon it to provide food on the table for their loved ones. It became clearer and clearer as Dr. Burks visited here in the middle of last week that there's a strong viewpoint that although it is hard to find quantitative data, to be fair, but it is a strong viewpoint of those on the coronavirus task force, and quite frankly between and amongst our experts here in Mississippi as well, that when you look at the rising number of cases amongst that 20 to 29 crowd, and you just anecdotally see what's happening in bars around the state, particularly in areas in which they are just completely ignoring the current, even the 50% capacity limitations, that there's a lot of spread that is happening in those facilities. And so the decision-making process is trying to weigh a strong philosophical bent against doing anything to hurt small businesses, while at the same time doing everything in our power to make sure that we slow the spread of this virus amongst that age group, which there is very strong quantifiable data which shows that it is that age group between 20 and 29 that is seeing the largest increases in the total number of cases. Just to give you an example, and I think I can find it pretty quickly here, the total number of cases amongst that particular age group, and I'll look at it and find it in just a minute, but it is growing rapidly. As I said yesterday, it's 34% of all of their cases have occurred in the last 2 weeks. And the 20 to 29 age group is the category with the largest number of cases in Mississippi right now. And again, we know that their survival rate is very, very high. So that's a positive that we can look at. But we also know that if there are thousands and thousands and thousands of 25-year-olds walking around with the virus, many of which are asymptomatic but yet are continuing to spread it, then it's that next iteration or that next iteration beyond that is going to lead to, as we've said, a lagging indicator of more deaths. And that's what we're trying to fight against. It's what we're trying to avoid. Not only deaths, but hospitalizations and more stress on the system. And so as we have sat around over the last 2 or 3, 4, 7 days, talked about the ways in which we could go about doing this, we do believe that when you look at restaurants, for instance, that are adhering to the guidelines, those who have tables set for less than 8 individuals, that spread those tables more than 6 feet apart, those that are operating in a responsible way. It is a way for them to generate revenue, to stay in business, to continue to stay open, while at the same time minimizing, not completely eliminating, but minimizing the risk of spread. And at the end of the day, that's the business that we're in right now, whether we want to be or not. It is, how can we go about everyday life in such a way where we put as few limitations and as few restrictions as possible while seeking to minimize the risk of spread.
A real quick follow-up.
Sure.
Is the social gathering limit really kind of targeting that same age group? Is that who you all believe is doing that as well, and why it's important that it be a statewide?
It's not limited to that age group, but I certainly think when you hear about large groups going to the sandbars, or large groups meeting at even at private homes. And again, I'm a firm believer that people can do typically whatever they want to do at home. I'm very much a libertarian in that regard, except when that individual crosses over into doing something that puts other people at risk. And you know, it's the same way. I really don't care if there was nobody in the world on a Mississippi highway how fast you choose to drive. But when I know there are other Mississippians driving on that highway, we have to have a speed limit because we have to protect all Mississippians and not allow one individual's decision to make a dangerous, to do something dangerous to affect lots and lots and lots of other Mississippians. And so it's the same way. Certainly those gatherings are designed to help curb those the number of 20 to 29-year-olds, 18 to 29-year-olds that are gathering. But there are adults that are doing it as well in larger groups. But certainly that's a big part of it.
Governor, I just want some clarification on these on the crowd, like the social gatherings and stuff. Would that impact businesses at all?
No.
Okay.
Businesses, the way in which we have structured it is private sector businesses, we have orders in place for virtually every single business that exists out there. And so this will not change the way businesses operate or the orders that are already in effect until Monday, August the 3rd for every single business that exists out there.
Caleb with Daily Journal has a question.
Good.
This is a question for Dr. Dobbs, and then I have one quick follow-up. Earlier in the week, a few days ago, I think on the 22nd, you tweeted out a graphic of counties in the state that you said had worrisome trends. And there were a number of counties from up here in our part of the state: Alcorn, Lee, Marshall, Pontotoc, Prentiss, Tishomingo. Now, obviously, I realize you probably don't have specific data in front of you, but do you have a general sense of where Northeast Mississippi is right now? And would you anticipate us needing to be added to any of the statewide orders, the targeted orders, at any point soon?
Yeah, the trajectory is certainly very worrisome. And you know, I'll tell you, I've got a couple reports. The decisions that the governor made today were based on reports from yesterday, where in the previous 14 days we had 174 cases from Lee, but one I pulled just a minute ago that was updated today, 199 for 2 weeks. So the trajectory is very worrisome. None of us are immune, not even other countries. Other countries that thought they had it under control, Hong Kong and other places that let their guard down too much, it's gonna come. So I am worried about every part of the state, and especially I think the Northeast, which has fared relatively well, is going to have more and more cases. Oh, but one thing I'm going to say, I forgot to say it earlier, since my mask is dangling from my ear, a mask does not work down here, and it doesn't work here. A mask only counts if it covers your whole face. So please, whenever I go to get some food, and y'all can watch me if y'all want to. If you work at some of the drive-throughs, I'm going to be watching to see if you've got it over your face properly. So please wear the mask properly. It doesn't help us if you're breathing infectious stuff all over us from your nose.
Sure, okay, and then just a quick follow-up. Obviously, a lot of the counties up here are quite rural. We don't have a lot of big urban areas, and that'd be the case, in other places like Delta. So, I mean, in a lot of those counties, we are starting to see spread, and it wouldn't, I assume, be driven by places like bars. So, I mean, is a lot of that just coming from person-to-person spread, friends, family members, that kind of thing?
Yeah, any sort of social gathering, anytime you put a lot of people together, especially indoors, but also outdoors, social stuff is killing us. It's going to be a party. It's going to be just people hanging out. It's going to be things that normally we applaud as a strong element of society, funerals and churches and that sort of thing. Anytime we put people together, there's going to be a risk, and we really, just for now, we need to avoid being around other folks as much as we can.
Yeah, Caleb, I'd just like to point out with respect to Lee County, particularly, we added Calhoun today, which is up in your neck of the woods. Dr. Dobbs mentioned the increased number of cases over a 14-day period in Lee, and it was about a 25 or 30 new cases over the 24-hour period. Lee County is on my list to watch because we had about 20 to 25 the day before as well. And so we've really gone from about 140 over a 14-day period to over 190 over a 14-day period. By the way, I think the city of Tupelo has had a mask mandate for some period of time. So, but regardless if that's true or not, Lee County is one that we are watching and monitoring very, very closely. And if the trends don't change, it could very well meet our objective criteria to add additional restrictions as early as next week. And by the way, I also want to point out, we added 6, we removed 0. I do want to say that if you look at a number of the counties, we are seeing positive movement on some of the counties that were on the original plan. I do believe that if you have a very strong participation in a county, that people are, if they're wearing masks, if they're concerned, if they're not meeting in large groups, if they are doing what we have laid out as a good strategy, it will work. And we're seeing that. We're beginning to see some of the numbers roll over. But in consultation with the health department, Dr. Dobbs and his team, we don't think it's time to take anyone off the list yet. So just as a reminder, we've added 6, but those other 23 still have the same concerns and same guidelines in place. So we've gone from 23 to 29, added 6, but they're still, the other 23 are still in the same spot.
Dave Elliott, WLX, has a question.
Thank you, Renee. Governor, I was talking the other day with the doctor about your surgical approach to identifying certain counties, and we're up to 29 now after today, as far as face mask requirements and other guidelines. And he pointed out that people are just moving to and from counties down the coast. Someone could go from Jackson County and shop in George, or go from Harrison County and stop at the grocery store in Hancock. Other governors, including Kay Ivey right next door in Alabama, just decided to go statewide on these mandates. Is there a threshold, some point where you would consider doing that?
Well, thank you for that question, Dave. And next time you talk to that doctor friend of yours, tell him I said thank you for his hard work on behalf of treating patients throughout Mississippi. There's no doubt that none of these decisions are easy. I have great respect and admiration for Kay Ivey. I've known her since before I got elected to state treasurer, because like myself, Kay Ivey was the state treasurer of Alabama, then she was lieutenant governor of Alabama, and now she's doing a great job as governor of our state. It is not lost on me that Texas and Louisiana and Arkansas and Alabama all have statewide mask mandate. It's not lost on me that there are certain physicians, maybe a large majority of them, that think Mississippi should as well. What I'm telling you, it is my view and it is my belief that it is not what the words on the page of any particular executive order say. It is what can we as a group, as a team, do to get the most number of people adhering to and participating in the guidelines that we set forth. And I believe this surgical approach is the best way at this time to identify the 29 counties that have either more than 200 cases over a 14-day period or 500 cases per 100,000 residents. And I think we are seeing, certainly in Hinds County, I don't think left Hinds County in the last week or so, we're certainly seeing significantly better participation today than we did a week ago, and even better than we did 2 weeks ago. And so my goal, which is the same, I believe, as that physician that you spoke with, Dave, is to get as many people in Mississippi wearing masks and protecting themselves and protecting their neighbors as possible. I just think this is a better way to do it. And I think we have seen some progress being made. I firmly believe that there is no doubt that that we as a state are better off if people will wear masks, if they will stay socially distanced, if they'll stay in the fight. And so I think this is the best approach for us at this time. But I will not take anything off the table. If at any point I believe that the best approach is to go to a statewide mask mandate, I'll do it in a heartbeat if I think that's the best thing for Mississippi and Mississippians. Gerald, do you have a question?
Yeah, for Director Rochelle. You have storms coming off the coast of Africa moving through similar pathways. Your biggest fear, your biggest worry as you continue to see this very active Gulf Coast in dealing with a pandemic at the same time?
Okay. Jerry, I'm sorry, last
What's
part.
your biggest,
Oh,
what's your
okay.
biggest fear?
I'm sorry. Yeah, my biggest concern has been what I've talked about before, and that's managing the shelter operations for those that don't. Because traditionally, folks will hang on to the last minute in hopes that a storm is not going to follow the forecasted route. Unfortunately, this season we're not going to be able to accept that risk, and I'm really promoting. So to your point, my concern is that people plan ahead and they move out. Now, I have had discussions as late as today about non-congregate sheltering, which is what we're going to work very hard to have options available to assist those that don't have the means, otherwise have the means to get. But the bottom line is, my biggest concern is that people will plan ahead or not plan ahead and be caught and then be stuck in a congregate shelter, thus increasing their risk for exposure while we see these increasing cases.
For those of you who can't necessarily see this, I'll just point out that I can see Gerald, but that pole right there to my right is directly in between the director and Gerald, and so communication is not perfect in a room where we're trying very hard to stay socially distant. So that explains some of that. So.
Nick June with Jackson Creek Press has a question.
Hi, thank you. Surgeon General today said schools should reopen at regions with less than 10% case positivity. Mississippi is currently around twice that rate. Is the Surgeon General wrong? What case positivity rate would preclude the August school openings?
By case positivity rate, Nick, do you mean test positivity rate?
Yes, I mean test positives per, positive cases per test.
Sure, okay. I just didn't see what the Surgeon General said, so I didn't know that. I will tell you that that we are monitoring test positivity, but what I've said here before, and I'll say again, and I'll turn it over to Dr. Dobbs if and he can agree or disagree if he'd like, but I personally believe that total number of cases and total number of cases per 100,000 residents is a better indicator than test positivity rate. Because I can tell you that I can go into virtually any community right now and significantly reduce our test positivity rate by going and testing randomly throughout that community. I can take the National Guard with a few Department of Health folks and go and just start testing people, and I can drive our test positivity rate down. But that doesn't do us any good. It's not it would simply be to drive the test positivity rate down, and it doesn't do us any good. And so there is no doubt that the coronavirus task force is focused on that. I've told you that Dr. Burks, the two criteria that she's looking at on a county by county basis are more than 100 cases per county over a 7-day period, and a test positivity rate that is more than 10% in those counties. And so when you talk about test positivity rate, if you look at that only as the only indicator, and not fully appreciate the total number of tests that you're doing, I just think it's an incomplete information. It is important, but it's got to be a part of the equation, not the only piece of the equation, is my humble opinion.
And in regard to the total state number, I think it's a pretty reasonable metric. But if we start looking county by county, there are a lot of local influences, availability of care, testing locations, and then singular events like a nursing home outbreak or a testing event can massively swing. In a small location, you don't really smooth it out. So I think it'd be a tough one for us to do school district by school district in a lot of our lower population areas. But certainly it is something that we do watch.
Alex with Mississippi Today has a question.
Thanks. I'm wondering, so when we're reporting these stories, and I think I can speak for a lot of the other outlets, when I say this is we tend to get a lot of pushback from readers about, not trusting these numbers or saying they're overblown or exaggerated. I'm just curious, when we talk about social distancing and mask mandates, how big of a factor do you think distrust in the media and institutions like the health department is in the spread of the virus?
Well, I think there's a lot of distrust of the media in this country right now, some of which is justified and some of which is not. I think there's distrust in institutions in this country right now. What I will tell you is I'm looking at the very same data that Dr. Dobbs and his team are looking at, and probably I spend more time looking at this data than anyone that is in an elected position, certainly in this state, and probably anyone in an elected position in this country, studying the data. Because if you don't make data-driven decisions, if you allow emotions to cloud your judgment, you tend to make much poorer decisions, in my opinion. And I think we can point to certain areas where that's the case. I don't think there's any doubt that there is some who have questioned the data, and what I have said, and you've probably seen our social media post in which we've tried to say to everyone that I think questioning authority is a good thing. That's part of it. I question my team and my staff and Dr. Dobbs and his team all the time. You're supposed to question it. What I'm here to tell you is saying that, looking at the data and saying I'm not going to wear a mask because I don't believe the data, I just don't think that is justified at this time. It makes absolutely no sense whatsoever. I talked about herd immunity, for instance. I've talked about questioning authority. I'm not opposed to everyone saying, hey, I want to be skeptical, prove it to me. I used to play a little bit of basketball, not very well, but I used to play a little bit, and I had a coach who loved to ask us a question, and when we would answer, usually in the affirmative, his response was always, well, I'm from Missouri, which of course is the show me state. And I will tell everybody in this state, everyone in Mississippi, that's the approach I take to looking at this data. Hey, I'm from Missouri. I want you to show me. What I'm telling the people of our state is they have shown me. I have seen the data. I look at the data. Is it perfect? No. Are there mistakes made day to day or small minor mistakes made each day? Of course there are. You're talking about tons and tons and tons of data. But I am confident that the data that I am reviewing to make decisions is accurate and is allowing for me to make the best decisions possible for the people of our state.
And just really quickly, I mean, healthy skepticism is very appropriate, and certainly everyone should be held accountable. Paranoia is a little bit destructive, and certainly a lot of the voices that I think carry the most weight are sometimes the loudest, but also to a minority. I appreciate all the positive feedback I get from folks saying, we appreciate what you're doing and all that kind of stuff. I really do. But consistency is really important, right? So, and also predicting. And what did we say a long time ago? We said, okay, we're going to be seeing more cases. We're going to see more hospitalizations. We're going to see more deaths. And it's happened because we've been following it very closely. And everything is coming together in a common narrative. UMC and all the hospitals aren't making up the fact that their hospitals are full. We're not flying people to Georgia because they can't get a hospital bed in Mississippi just for the heck of it. Everything fits a narrative that makes sense. Be skeptical of the skeptics, because it's really easy to have a wacky idea and a medical degree from Facebook and think you know what you're talking about. So, please, please ignore conspiracy nonsense and I've spent my whole life doing this. This is what I've committed myself to. This isn't just some random one-off sort of thing I'm doing for fun of it.
Yes. For Director Michelle, we've seen a lot of economic fallout from the coronavirus, and there are some families that are going to be struggling on the Gulf Coast that might not be able to afford the hotel room upstate for like a week or so, however long it takes for them to be able to come back home. Are y'all prepared to handle those extra people that normally would be able to afford to get out and evacuate but might not be able to right now?
Yeah, so, and good question. Thank you for asking that. One of the things that FEMA has included in this COVID response is ability for us to include a non-congregate sheltering piece that we can work through public assistance. So that is one of the things, and back to Gerald's question, it was one of the things that we've been talking about today and putting a process in place, and what that would allow. And let me just be real clear, we don't have that in place right now. We're working to include that in, and I know it's albeit very late, but we want to make it available. But to give those an opportunity that might not otherwise have resources to be able to go to a hotel so that they can be in a safe place, segregated away from other people, and thus lower their risk of exposure. So we're working on that, and yes, there are resources. We just got to figure out how to get that mechanism in place to get it to those folks in the most expeditious manner. More to follow on that.
Yes.
Do you think it's important for folks at home to realize that although the number of counties under these restrictions, it's not even half of the state's counties, but if you look at it by population, I mean, even just with the 23, it was nearly 48% of the population, if I figured it out correctly. So much of the state, they are seeing enhanced restrictions, whether it's a statewide mandate or not. Do you think it's important that people kind of think through it in a broader lens and realize what's going on?
No question, and I think as of today, over half the state in terms of population is under a mask mandate in Mississippi, but it also plays to what we've been talking about. When New York was at its height in battling COVID, what was happening in upstate New York and what was happening in New York City were very, very different. And so larger populations that are more likely to gather for social gatherings, and more likely to gather in bars, and more likely to have a larger percentage of young people in them, certainly plays a role in all of this. And what's the total number of cases in Hinds County, for instance, and the total number of cases in Tisch-Amingo County are very, very different. And so that doesn't mean that there's not spread in Tisch County. There's no question that there is. There are people there that have it, and but the sheer numbers are very, very different. I looked up what I was looking for earlier, and we've had, let's just say, roughly 50,000 cases in Mississippi, and right at 20,000 of them, 40% are between 18 and 39. 40% of the cases between 18 and 39. Now again, only 33 fatalities at this point between that particular age group. But the problem is when they have it, oftentimes asymptomatic, and are spreading it to the next person, usually their mom or dad, and then that person either goes into a nursing home unknowingly, no one's doing this necessarily on purpose, unknowingly into a nursing home, or then goes and gives it to maybe a lot of these homes are multi-generational. Grandmom lives with you, and then grandmom or granddad gets really, really sick, and so that's what we're trying to just make people aware of, to be cognizant of, and we think if we can convince all 3 million Mississippians of the things that they need to be doing, we believe that the vast majority of them will actually do it. Yes.
Jackie with WHBQ has a question.
Good afternoon, Governor. I had a question about the young people. You kept on talking about how younger people have contributed to the spike. Do you think these new bar regulations will be enough? And would you ever consider shutting down bars completely? Also, if that doesn't help, would you consider banning maybe live music in some of these bars or DJs, since young people are drawn to that? And I also have a follow-up.
Yeah, sure. The first way in which I would like to answer that question is, if you ask the question, would you ever consider, it doesn't really matter to me what you say after that. The answer is yes. I will consider anything. That doesn't mean I'm going to do it, but I will consider anything. And I think if you ask Dr. Dobbs maybe privately if I would consider anything, he would agree, at least in the 5 months that we've been working, 5 or 6 months, however long it's been that we've been working on this. I'm willing to consider anything to help protect Mississippians. The live music piece is certainly one that we've had a lot of dialogue around. There's no doubt that we had shut down live music for a period of time back in April. And there is no doubt that that is one approach. As we talk through it, we believe that if our small business owners that are operating these bars and restaurants will adhere to the rules that we are putting in place today immediately, we think that will go a long way towards stopping it. We think it's okay that if you're sitting in a room and someone is 20 feet away from you and playing a guitar, and you're sitting in a group of less than 6, and that group of 6 is 6 feet apart space from other groups, then you can do that in a safe way. And so what we're trying to do is find avenues whereby everyone that depends upon income to provide from their families has a way in which to provide that income, but to do it in a safe way. And so, yes, I would absolutely consider shutting down bars entirely. I would absolutely consider shutting down live music. But I think, and I believe firmly, that if the folks will adhere to these rules, then I think it will go a long way towards getting there. Now, when it comes to small businesses that require a liquor license, for instance, to operate, there's a little bit more of a stick that can be utilized for them if they choose not to completely ignore it. It's sort of like restaurants. If restaurants choose to completely ignore the guidelines, the health department has the ability to go in and talk to them, and they've done it numerous times with various restaurants around the state, I am sure. Obviously, ABC handles liquor licenses. They certainly don't have an unlimited staff. They have a very small staff, in fact. But I feel confident that if there are repeated reports of individuals that just absolutely choose not to adhere to the guidelines, then there will be repercussions. Gerald. Oh, I'm sorry. She had one follow-up.
I have a follow-up really quick. Sorry. Again, could you speak a little bit about the younger age groups and what percentage of the young people from ages 0 to 17, and I think it was 19 to like 29 or something, how many of those people are in the hospital now? Maybe Dr. Dobbs, or you could tell me about that.
Oh boy, I don't have that information. I mean, I know we do have a few young children in pediatric ICU from coronavirus, but the hospitalized data, we don't have that real time. It's all retrospective, so I don't have a number on how that's broken down.
Yeah, I think I have no idea what the specific numbers are of that particular age group. In general terms, having watched this for 5 months, they're much less likely to be hospitalized, but it does happen. It does happen with very young folks that do react very violently to the virus, and so the best way to keep from getting hospitalized is not to be young, but to not get the virus. Gerald.
It seems as if the largest increase day over day from today, yesterday, with the coronavirus, and of course testing and all of that extra stuff is implemented, is the age group between 6 and 11. Have you, the health department, considered giving out guidelines or a recommendation on reopening, whether that's setting a specific day after Labor Day or something of that nature to these schools. I know we have a couple that have considered that. Have you as a department considered that?
Yeah, I would like to make it pretty clear that I know we talked about this before. Is that early in this journey we discovered pretty quickly that the districts have a lot of autonomy, and so we've given a lot of guidance to them, both based on CDC and other stuff that we've worked with them, and respecting that autonomy. But other than that, though, we have given them pretty good sort of pathways to try to find the safest activities that the kids can do. Trying to find coupled with the CDC stuff about in-person versus online, and certainly understanding that certain kids really do need to be in the school, like the governor talked about yesterday. There is some merit to delaying school, and certainly there's a lot of conversation about that. The Mississippi AAP has had a lot of conversations about maybe talking about delaying school because of the high number of cases. But if we're going to do that, we have to couple that with a commitment to get the numbers down. Because what I'm seeing right now is the numbers are not going to be better in September, they're going to be worse. They don't have to be, but delaying as appropriate and getting a little bit more time to make plans and also too to see where things are is a very valid approach, and it's something that I think can make some sense. But I think there's just more to come on that conversation.
Yeah, I'd just point out that every district is supposed to have their restart plan into the State Department of Education by July 31st. I will tell you that the rising number of cases is definitely a concern, but I'll also tell you that we've been out of school since early March. There's been adequate and sufficient time for our school districts to plan, to innovate, to make decisions that are in the best interest of kids. And I remain an eternal optimist. I'm optimistic that we're going to get those reports back in July 31, and a large majority of districts are going to have innovative plans in place. The notion that we are going to stay out of school until we can come back with no risk of the virus and teach just the way we've always done it is not an acceptable option, period.
Gracie here, has a question.
Hi, can you all hear me?
Yes, ma'am.
Okay, thank you. Governor Reeves, you actually brought up the point that I had a question about. In terms of reviewing districts' restart plan, how in-depth are you hoping these plans are? For example, there's a difference between just saying, yes, we will have a cleaning crew come in periodically, to being very, very descriptive and outlining, we're going to make upgrades to our ventilation system because we have concerns about the virus possibly spreading. I'm just curious about how in-depth are you hoping that districts are about logistics when they submit these plans to the State Department of Education for your office to review?
Thank you, Bracy. I appreciate that question. I think they need to be as in-depth and as specific as is necessary to provide a plan to get kids back in school in a safe, responsible way. And in some districts, that's going to require a more in-depth version, and others it's going to require less. But that's my hope, is that there's been a significant amount of time, effort, and resources spent over the last 4 or 5 months developing these plans. And so I think it's going to have to be pretty in-depth.
Thanks so much. Governor, I'm curious about the threshold for the counties that fall under the stricter guidelines, the 200 cases in 2 weeks and the ratio. Is that a hard and fast number, or is that is that subjective to you and your staff on who gets under that stricter threshold?
Yeah, what I would say is thus far it has been a hard and fast rule. We haven't added anyone that was not over 200 cases over a 14-day period or more than 500 per 100,000 residents. Now, I will tell you, we did have conversations about a couple of counties, Lee County being one of them, where we did see over a couple of day period a pretty significant increase. We also had conversations around a couple of those counties that we initially put on 2 weeks ago as to whether or not we wanted to take them off because they've actually fallen under the threshold now. They're no longer under it. And we made the decision at this point to leave those on for another week and see if we can continue to see how much we can tamp down the spread there. And again, we have hard and fast rules, but we're also trying to be flexible.
Yeah, Governor, you know, earlier on in this month we were talking about like sports reopening in the fall. We've already begun to see this week some conferences saying they're postponing until the spring, and then today the Mississippi Community College football is decided to delay until October. What is your reactions to those delays?
Well, I think you're going to see a lot of, particularly college football, at least initially, looking at delays. And keep in mind that the weather's getting really bad in Jackson. For those of you who are wondering, I sometimes wish that we didn't have the blinds up here in this room. But I think what you're going to see is, particularly amongst those entities that play sports with large crowds, because remember, one of the things that Dr. Dobbs has said repeatedly is it's one thing to get schools in school buildings with 30 different rooms and 20 to 25 people in a room, and something entirely different if you're trying to put 50,000 people in one setting. That's a totally different issue. And so I'm not surprised at all that some of these institutions are deciding to delay large gatherings. I mean, I think some youth sports can continue in a safe way. I think there are some tournaments that are ongoing right now that are probably are ignoring the guidelines that are in place, and I hope that we'll have folks out and about looking at that this weekend. And I would not be at all surprised if we didn't have new guidelines in place for youth sports early next week, based upon what I'm afraid is some cities, not all, but some cities with large parks that just are completely ignoring the laws that are on our books. And so we're going to be looking very closely at that over the weekend. Well, it is 3:30, has been 1 hour. I don't see any additional questions at this time. I would actually, is that Emily? Yeah. One last question.
Hi, thanks, Governor. I appreciate it. And my question is actually for Director Michelle. Does Mississippi have any requests for ventilators or other coronavirus equipment or supplies that have not been fulfilled by the federal government?
We do not. And just let me just expand on that. The ventilators issue that we had was an issue that we had early on with a number of other states. There was concern that ventilator usage would be much greater than it is. That request to HHS was originally canceled. There was some miscommunication in a report that went out yesterday that we were still waiting or depending upon the federal government for that, and that was not the case. Although you've heard me say a number of times here before that we did not get as much from the feds that we would have liked, but there were other states out there that had a greater demand and a need at the time. But at the end of the day, we got everything that we asked for through an RF to FEMA we have received.
Seeing no further questions at this time, thank you all for being here. Going into the weekend, I just encourage all Mississippians to wear a mask in public, to stay 6 feet apart. Please don't gather for social purposes with large groups. If we can come together over the next 5 to 10 days and really make a commitment, we can slow down the spread of this virus, and we can be talking about football and basketball and soccer and doing all the things that we want to do. But we have to come together as a family and make the commitment to make it happen. So enjoy your weekend. Hopefully enjoy it by yourself and with your close family. Thank you all. Stay safe and God bless.